I'm Monica Beard. I'm the behavioral health coordinator with Mary's Place. I work at the day center. What I do here is a lot of behavioral health resources, connecting with medical care, working with guests just to kind of support their like overall behavioral health needs. I also help guests with shelter resources or getting applying for any social service, public assistance, IDs, anything like that. A lot of it really is coordinating with them and providing supports in terms of groups, trauma supports, anything, crisis and crisis services, anything like that that might help their like overall wellness while they're here. And our ultimate goal is really to get them the temporary needs and services that they would need to be successful when they transition into housing. When we're thinking about why it's so challenging for folks living in homelessness to access medical care or behavioral health care, a lot of the guests that we're working with right now, especially at the day center, they've been unhoused for quite a while. And a lot of times what they really need are what we focus on most immediately is their most basic needs. And so it's clothing, food. I think the other thing that can make it really challenging is the thing that we call sort of the digital access and digital divide of living in homelessness. So a lot of our guests may lose or have a phone stolen or don't have access to current like Wi-Fi or can't make appointments because they are not able to call or have a provider call them back. And so we're able, like at the day center, we have really great partners that work with us volunteering for medical care. We have a Bastyr student clinic here. And so we're able to receive, like our folks are able to receive medical care. But a lot of our care coordination, a lot of the work that we do and our clinical health and behavioral health team is coordinating with those partners and helping our folks just access those certain resources. We can help them set up appointments. We can help them with transportation. What we're also sort of helping with too, with behavioral health, especially at the day center, we do a lot of partnerships and kind of education around supporting the guests that we have in supportive housing. We work with the like case managers and things like that on site just to provide some support if they need it and if they have questions. So any guest that we've sort of referred, we work with our community partners to kind of coordinate all of those and make sure that they're just stable. A lot of the stigma that I see that people sort of think about with mental health is that it's sort of an individual issue, that it's some sort of like the guest has caused it by themselves, rather than looking at homelessness and our mental health care system as like an overall system that impacts guests and their access to care. Guests come to us with a lot of life that they've lived before, and a lot of experience, a lot of trauma, and sometimes coping strategies. So we just incorporate a lot of the work, like a lot of the life, and look at who they are as people. What I would love is if I could really share just seeing people that they're still human and looking at people as people would be a really great thing and sort of a way for us to reduce a lot of the stigma around mental illness. And I think we continue to sort of strive for growth and the innovation and programming and being able to support guests and like really understand their needs. That's always what I'm excited about and what makes me the most happy working at Mary's Place.